A new study seems to confirm what many have already suspected regarding the number of coronavirus deaths in the state of Florida. Now, Florida, under the leadership of Governor DeSantis, was one of the first states to open things up and just go back to normal as if we're not dealing with a global pandemic. And what was interesting was, fairly recently there were comparative analyses done, showing how California fared compared to Florida. Florida opened everything up. California at the time had still shut everything down. But the numbers of coronavirus cases and deaths seemed pretty comparable. So what was going on there? Well, it turns out that some researchers argue that the way officials in Florida count coronavirus deaths is a little skewed in a favorable direction for DeSantis, and I'll explain how. Researchers came to that conclusion by comparing the number of estimated deaths for a 6-month period in 2020, that was from March to September of last year, to the actual number of deaths that occurred, a figure known as excess deaths because they exceed the estimate. There were 400,000 excess deaths known, or excess deaths across the United States in 2020, okay? So when you look at Florida specifically, the researchers say 4,924 excess deaths should have been counted as resulting from COVID-19, but for the most part, they were ruled as having been caused by something else, thus lowering Florida's coronavirus fatality count. That's possible because people who die from COVID-19 often have comorbidities such as diabetes and asthma. And so, Aida, I want to bring you in because as I was reading the way that they manipulate numbers like this, it made me think of George Floyd and how they tried to blame George Floyd's death on anything other than the fact that Derek Chauvin basically suffocated him to death with his knee, right? It was like, no, it was actually the fentanyl. No, it was actually his this or his that. But in the case of corona, obviously that's BS, right? But in the case of coronavirus, I would argue that it's also BS. I don't know, what do you think?
Florida manipulating numbers? No. The whole election, I think that enough is enough. The ridiculousness with the people, Florida and Georgia and Texas these officials have been having a field day with this coronavirus and their approach. And meanwhile, the people who are dying are the ones that don't have access to the healthcare that they have access to, or any of the information and the stuff that they have access to. I think that I truly, wholeheartedly believe that they've been manipulating numbers. They've been throwing that in our faces because the people who are dying are people who belong to groups that don't really matter to these people. So they probably have been manipulating numbers because why is it that everybody else has been devastated by this virus, but then places that have high concentration of people who don't believe it's real? Of course, all of it goes into play together. You have a whole bunch of people who don't think that this is real to this day. People who you're still hearing about fighting about wearing a mask. People who want to continue to have spring break events and parties no matter who's at risk. And then the people who are dying are older people, Black and brown people, poor people, people in marginalized situations. So of course that it's very possible that they are manipulating the numbers because as usual in America, those people don't matter.
Yeah, I mean, you make a really great point. Florida is the second state in terms of elderly population. And so I tend to forget about that because when I think of Florida, of course, I think of like South Florida where I visit my in-laws. Right. But Florida has a giant, retired community. And as we know, coronavirus is far more likely to be lethal for elderly individuals. And so, there's also this issue, and it's not just about Florida. I mean, you'll notice this throughout the country where depending on where you are, the health officials will decide whether or not to count the death as a coronavirus death or to consider the death as something that was caused by the comorbidity. Now, to be sure, all of the patients we're talking about had coronavirus. It's just that the way that they're recorded really depends on how the health official decides to list them. Is it COVID or is it because of heart disease, right? They might not have died from a heart attack, but depending on their own discretion, the health officials' discretion, they'll decide if it's COVID or if it's some heart issue. And so as Daniel Weinberger from Yale mentions in this Yahoo News report, some states classify a death as due to COVID if a positive molecular test was obtained, while other states allow the death to be classified as due to COVID if there is a suspicion that it was caused by COVID, even without a molecular test. So, I mean, there's just no uniformity across the country. And I think that stems from the fact that we never really had a robust centralized approach to combating this virus. I mean, come on. Of course, we get hit with a global pandemic during the Trump administration. I mean, it couldn't have been any other way, right? And there is one other statistic that I want to share with you all because I do think it's relevant. Because excess deaths were at 21% nationwide for 2020, and that's according to CDC figures. Florida saw a 15.5% rate of excess deaths for the period that was studied. California's excess death rate was also 15%, despite that state's governor, Gavin Newsom, having enacted much more stringent restrictions than did DeSantis in Florida. So obviously the difference in excess deaths between California and Florida is notable, and you should keep that in mind. But it goes beyond government policy, state government policy. I think it also has to do with whether or not people are willing to follow through with social distancing guidelines and things like that. So Newsom having strict rules didn't necessarily stop some of these massive warehouse parties that were broken up by cops, when COVID cases were spiking more recently. But I do think that it's fascinating and should be investigated further that Florida somehow miraculously seemed to not follow any social distancing guidelines beginning in August of 2020, and somehow their numbers are lower, much lower than some of the states that had strict shutdown measures. So we'll see how this goes, but don't think I forgot about the fact that DeSantis got one of their data scientists fired because she was accurately reporting data regarding coronavirus cases and deaths. So do I think that there's a pretty big possibility that they're suppressing numbers or at least manipulating numbers? Yes, but I would also caution you about this one study because based on their comparative analysis, it doesn't really seem like the number of excess deaths in Florida versus California is that big of a deal. Really, there's no difference.
Thanks for watching the Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.